Hello and welcome to the Health Freedom Hub. I'm your host, Jeff Cantor, and today we're meeting with a longtime health freedom advocate, Michael Gould. So Michael, welcome today.
Thank you. I appreciate the invitation.
Hey, and let me give a little rundown on you so everyone kind of has a handle on who you are. He's got about over 40 years of healthcare experience and has done a variety of things. Started and operated some dental HMOs and sold those off. Did the body scan network where they were doing some imaging and business. And then now, most excitedly, he's in the ScripsNow business, president and CEO of that. And that is an organization that provides in-office dispensing capabilities for doctors, something they didn't really think that they could do. So pretty exciting, I must say. So let's talk about the latter part, because for us this is a big part. We're talking about health and freedom and all the rest of that stuff, and cost is a big part of this. And then also patients have responsibilities. Now, more so in some of the idea of being in a free market world, you're going to have even more responsibilities. But even if you use traditional health insurance with a small copay and a lot of your life is directed for you, there are things you still need to do, like when your doctor says, here, take these pills.
Exactly.
So what have you been encountering? What does this allow for doctors to be able to do?
Well, one of the things that many doctors are still completely unaware of is that if you have a DEA license, you can write a prescription. You can also dispense it directly to your patients. There are about 8 states where it is either severely restricted or prohibited. For example, New York, Texas, Massachusetts, Utah, Montana, a couple of other states where they've made it so restrictive in terms of if a doctor wanted to mark up the medication, for example. New Jersey had a regulation that a doctor is able to dispense medication, but they can only mark it up 10%. So where you're dealing with a medication where maybe it's no more than $6 or $7, for the amount of money that you're going to make in profit, it's just not worth the hassle. And we just stay away from that. But for the rest of the states, it's legal. Sometimes you may have to file with the state for a particular form. There may be a small registration fee, through maybe the state pharmacy board or the medical board, but it is completely legal. So for a physician, for a dentist, one of the things we tell our clients is that you're not going to be a pharmacy. This is not going to create a huge burden on your staff, which is a major issue. Looking at a medical practice today, for example, you're buried in paperwork. You're dealing with HIPAA. You're dealing with fighting with CMS. You're fighting with the insurance carriers. You're dealing with, I think, like 60 some odd thousand ICD-10 codes. And the last thing they want to do is impose an additional burden on their staff. There really is no burden. You can actually, when we pick up a client, they define a formulary, and we tell them, look at the 80-20 rule. In most cases, 80% of your patients are getting the same 20% of the medication.
Certainly.
Antibiotics, anti-inflammatories, injectables, and creams, ointments. And what we tell them is for the items that are less frequently prescribed, don't order it. Give them a prescription.
And tell them to go.
Fill it and fill it at the local pharmacy. The actual dispensing process, we have a secure portal. They log on to the computer. They log into their portal. It's got a list of all of the items that they're carrying in inventory. It might be 15, 20, 25 items at most. And then they order as they need it. The system, if they use the online system, will maintain the inventory for them. Every time they dispense an item, it will automatically take one out. It'll notify them when they're at the certain trigger point that they establish. Your amoxicillin is down to 9 bottles. It's time to reorder if you want. And it's a very, very simple system. In fact, it will print, the bottles are all labeled. They're labeled, they're packaged directly either by manufacturer or the repackager. And then you have the ability to print an additional label which has the name of the practice, the name of the patient, the date. If you have multiple doctors in the practice, the name of the doctor that prescribed it, and then the directions. And all of that is exactly what you would get at your local pharmacy along with the medication information sheet. So for the patient, it's exactly the same thing that they would get at any local pharmacy. And the advantage to the patient, because as we'd mentioned earlier, 1/3 of all patients do not pick up their medication even if it's called into the pharmacy or e-scripted over. They just don't pick it up.
Pretty remarkable statistic, frankly.
And the hard part is that if you're dealing with a patient, let's say a senior, who has chronic health conditions, which is not unique to a senior, but high blood pressure, diabetes, heart disease. If you're not taking your medication as prescribed, you're going to exacerbate the condition. You may wind up in the hospital. Mm-hmm. And if the doctor gives it to you directly at the end of the appointment, you're more likely to take it.
Mm-hmm. And then they know that you have it.
Exactly. Yeah. And also, when you look at, say, a pediatrician, and not that it's limited just to pediatrics, but if you've got somebody who comes into the office, whether it's a sick child or just somebody running a fever, the last thing they want to do at the end of the exam is to have to first go to the pharmacy and wait 30 or 40 minutes to have it filled, as opposed to either putting the child back to bed or you going back to bed. Mm-hmm. And trying to just kind of work your way through whatever you've got.
Absolutely. And for doctors that have done this in the past, I mean, historically, what, did they just have big giant pill bottles and they counted all the stuff out individually, or how would it?
No, actually it's not. That's a good point. Thank you for mentioning it. These bottles are all filled to the most common dosages. So, for example, a real simple medication, amoxicillin, a real standard antibiotic. Mm-hmm. So a doctor says, I prescribe 500 milligram amoxicillin. I want the patient to take 4 capsules a day for a week. The bottle that we send them has 28 capsules in it. Mm-hmm. I want them to take it 3 times a day for 10 days. They've got 30 tablets in there or capsules in there. So it's exactly the same dosage and volume that they would get at the pharmacy, because they basically order it that way and we ship it that way.
Well, that's fantastic. So yeah, I can see why it would be so convenient. It's as easy as opening the cupboard and grabbing the pill bottle out and handing it off to the customer. So that's great.
Exactly.
And then so for the doctor's office, I mean, it's doing a couple things. One, now I know my patient has these pills and, the compliance will be better and that type of stuff. What else is it going to do for my office?
Well, one of the things that we talk about is that when you write a prescription and you send them on to the pharmacy, that's the end of the transaction. If you're dispensing the medication in the office, you're able to mark it up. Now, there's some reality in there. You could not mark up a bottle and charge $40 for something that's, quite a bit more expensive than the pharmacy. So most of the offices may mark it up anywhere from $8 to $10. And depending upon the practice and the specialty, certain practices may deal in a particular medical condition that requires, on average, more prescriptions for the patient. Mm-hmm. But depending upon the size of the practice and the type of specialty, I've got some really, have bid on some very large practices that have 10 or 12 doctors working in them, where they're actually able to generate hundreds of thousands of dollars a year in additional revenue to the bottom line. We actually use a profit calculator that we have on our website, and based upon the numbers they put in, we used to do trade shows where doctors would come by and line up just to play with the calculator, and it looks like a speedometer on a prescription pad. And when you put in how many offices you have, how many doctors in each office do you have, if it's a solo practice, single practice, you may have 8 or 9 doctors in one office. And then how many scripts a day on average do you prescribe? And then what do you want to mark it up? And as soon as they slide the slide bar on what the markup will be, all of a sudden you've got dollars appearing in the middle. And it starts to get very dramatic depending upon, those numbers, which is the doctor's numbers. We're not making up anything. We're just putting the numbers in.
With the doctors marking up, is it typically still cheaper than the pharmacy? They're not trying to match that price. They're usually trying to be a little sharper on price. Is that typically the case?
Generally speaking, Walmart broke ground and was like groundbreaking when they came up with their $4 generic medications, and then Target followed, and little by little, many other big box stores followed. Sure. Not all. Well, if you're looking at a $4 medication, and for the doctor's office they're charging you $10, there may be some people that go, you know what, I can save $6. I'm going to drive and spend an hour between driving and waiting in the pharmacy.
Yeah,
or for many people, if I'm sick, I don't feel well,
right,
let me get it here. If it costs me a few more dollars, it's not much more than I'd pay at Starbucks.
Right. That makes sense. I mean, again, there's such a convenience factor. I mean, my doctor's helping me. I don't begrudge them making a couple bucks at that point. And if anything, it makes my doctor a little more efficient and safer for me. They're going to survive. So it's a good thing all the way around. So what would you say your penetration level is? I mean, have you just started to scratch the surface out there, or how many doctors do you think you've got yet to go?
You're really just scratching the surface.
Right.
I mean, we've actually had doctors who give the medication away for free. So a lot of it depends on what your business model is. I know there's been a big shift. I mean, it's de minimis when you look at the total number of doctors, but many doctors are burned out. I mean, the burnout rate in medicine is very frightening,
It's terribly high.
The suicide rate. And what a lot of doctors have done is converted over to either a concierge practice or to a direct primary care practice, which is subscription based. And in those situations, many of them will actually give the medication away for free because they're paying a monthly fee to be part of the practice. And what they're doing is they're taking maybe a doctor may have 2,600 patients of record. Obviously, they're not all coming in. And then what they'll do is they'll lean their practice down to maybe no more than 600 or 700 patients, all of whom are paying them a monthly subscription fee, for single, two-party, and family. And then part of what they're giving them, besides their free, all the primary care services are free. Most of the lab work in their office is free. The X-rays, if they have an X-ray unit in there, and then they give them the medication as well. So they kind of close the circle of health in terms of what they're providing.
That's a fantastic arrangement for them. I can see how great and appealing that would be. And it looks quite good because obviously I've built it into my subscription fee, but I'm able to give these meds away on a free basis seemingly, so it's a wonderful feel for that consumer.
Exactly.
Now, you say you're doing doctors and dentists. How much of the practice that you engage in are dentists? What's the percentage of your...
I would say probably the majority of them are dentists. And the reason for that is that when we put the company together, one of the things we looked at is, I spent a lot of years in the dental field. At one time I had 5 dentists for partners for 11 years. So it was an easy market because I knew so many dentists.
Well.
And then we actually have a contract with Blue Cross Blue Shield from a very large PPO. It's a dental PPO, and they make us available to about 40,000 contract offices as a value add to their patients. Now we're doing a big push on the medical side because while I enjoy business is business, the reality is for a dentist, they may only have 5 or 6 medications of choice, 3 or 4 antibiotics.
Very limited by comparison, sure.
Periodontal rinse, that type of thing, whereas on a physician, it's a much larger formulary because they deal with more specific illnesses.
Absolutely. That's fantastic. So based on the way the thing has been growing, I mean, what do you think? Are you going to double the number of doctors? How's that going to go from next year and so on? What do you think is happening on your trajectory?
Well, one of the things we're looking forward to, and obviously we're very appreciative of what we're doing today, is using social media more. So I do a great deal on my personal Twitter feed. We have a Facebook page. We get hundreds, if not thousands, of people who visit it. I post about 30 to 40 articles, healthcare articles a week. And so we get more and more followers that way, and that generates business as well. And also just creates an awareness not only of the name ScripsNow, but also Mike Gould, so it's interchangeable.
Well, and the fact also you're building yourself as to be much more that expert in everybody's eyes, too, with all that publication and stuff. So that's really exciting. Now,
and I try to do that.
Now, consumers find you, too, so you don't sell direct to consumers. What are you typically telling them to do, or how do you help them grow your business?
Well, interestingly enough, I've never had a consumer contact us. Well, I take that back. Occasionally somebody will comment on an article that I've posted, and then they'll ask how did they get it, and the only thing we can tell them is contact your family doctor and ask them if they ever considered doing in-office medication dispensing.
A little word-of-mouth social media work on that side, too.
Exactly.
Yeah, and that's what it's going to take. I mean, you see ads on TV all day long about these pills, and at the end of which it says, go ask your doctor. So,
that's interesting because historically, pharmaceutical companies use detail reps where you'd have somebody come to the office and typically they'd bring lunch and they'd bring goodies to give away and then they'd leave samples. And, so people would go in and say, oh, that purple, they have the purple pill, Nexium. Well, then they started advertising on TV, ask for the purple pill. And little by little, many of the pharmaceutical firms found that, they could eliminate some or all of their field force and the cost they were spending. And many times, they'd be putting on seminars. We're in Hawaii, and doctors would go to the seminar. So, little by little, they thought, if we direct our message directly to the consumer, they can ask their doctor, hey, by the way, I saw something for generic Viagra. Do you carry that? Or something for Nexium or Prevacid or things like that. So this way, the doctor will look at it and goes, if they're basically the same, then fine. You want that? I'll write you a prescription for Nexium or Prevacid or some other antacid medication.
Sure, interesting. So yeah, things continue to change. Well, this is a pretty exciting proposition here. What do you think, kind of what you're introducing, what are the other little areas that are going to start to emerge for doctors' offices to kind of streamline themselves? Not necessarily the exact thing you're doing, but what are you sort of seeing trend-wise or other up-and-coming things going on?
Well, one of the neat things in using social platforms, like LinkedIn, for example, I've got over 2,700 connections on LinkedIn. About 70% or more are doctors, and then maybe another 25% are senior level execs in healthcare companies. So one of the things, I connected with a gentleman in San Francisco who's a cardiothoracic surgeon, and he's got a platform in telemedicine, and I see telemedicine as a very, very large growing thing, especially for areas where it's more rural, and maybe a rural physician where there's a very low density of physicians who has, let's say, a patient, and he's concerned about a possible heart condition. Well, you can actually connect up through telemedicine with a cardiologist. Now utilizing digital X-rays, you can literally share the same digital X-ray with world-class oncologists all around the country. You can share the lab work. There's a young doctor in down toward Detroit that I had connected with. I got together with him for coffee one morning, and he was talking about that there's evidently some platform made up of specialists. So if he had a patient where there was a question about, let's say, kidney disease, and he wasn't quite sure if he needed a referral, he's got the ability to connect up with a nephrologist online, send them all the data, talk about what he's done, and then the consult right there is, what you're doing is exactly right, continue it, or you know what, you really need to send them to a nephrologist, and then they would do that. So there's a collaboration that never really existed before. They're doing with machine learning, which is a little frightening. There was a project, I believe, using the IBM Watson, and with patient permission, they shared about 160,000 patient records. And Watson learned, which was a supercomputer, learned to read all the X-rays. And they were finding that Watson is able to diagnose cancer on X-rays much faster than a radiologist can. And right now they're using it maybe collaboratively for an opinion as opposed to making the definitive diagnosis.
Sure.
But little by little, we're pulling together all kinds of artificial intelligence, telemedicine, kiosks that is changing how we deliver care. And I'm hoping that it's actually for the betterment of the healthcare system, and it doesn't wind up taking off in a direction that may do more harm than good. I don't think it will, but you never know.
Well, that's kind of whether we're going to let that occur or not, if we're going to control. But you're right about it being a great leveler, because look at all those rural areas that are, can typically never attract a doctor, and now they can get the same kind of quality of care that they could get in some major urban area with this new technology's reach. So it is pretty exciting to see where things are going to go. We haven't even begun to scratch the surface on what's going to happen next that we can't even dream up here at this point. The entrepreneurs of the world are going to create for us. It is pretty exciting.
I posted an article about a week and a half ago about a hospital that's using robots. Now, they're not the kind of robot that you would think of as a robot, but it's an automated device where they literally are able to send it around the hospital to deliver things faster than if you had to have a person, especially in large hospitals. And you see these things going in and out of elevators and down halls, and they're programmed exactly where they've got to go, and they deliver the stuff, and then they go back and they deliver. And obviously you're not dealing in a human asset, you're dealing with an automated asset, but it's streamlining how you're disseminating information, across, multiple floors and multiple wings and things of that sort. So you never know where it's going to go.
No, it's going to be pretty exciting. Well, we're going to definitely explore more of this as time goes by, and I definitely appreciate you spending some time with me today. And for the people that want to learn a little more about your operation, and doctors especially, where would you direct them to go?
I would say use my Twitter feed, and if you just type in, Mike Gould, ScripsNow, it'll pull me up.
Okay.
And also on Facebook, we have a rather aggressive Facebook page, both on the Twitter feed and also on LinkedIn. My LinkedIn page is Mike Gould on ScripsNow on LinkedIn, and you'll be able to follow the articles that we post periodically. I'll actually write an article, 1,500, 2,000 word article that they're all on healthcare. And hopefully you might enjoy those, on paradigm shift in healthcare. There was an article I had posted a couple of years ago when I between HMOs, when I took some time off. I volunteered at La Brea Tar Pits in LA and happened to discover a 30 to 40,000 year old mammoth molar that I literally excavated, and I'd have a whole article of me taking that 40,000 year old fossil out of the ground and what it looks like, and it was really an incredible experience.
I'm sure.
There's a lot of different articles I've posted, so
that's good.
Hopefully you'll go over and look at some of the things I've developed.
Fantastic. Well, again, thanks so much for spending time today, and we will definitely connect again.
Jeff, I want to thank you very much, and I look forward to it.